it's Jay. Today's video is about the anatomy of a peripheral nerve. Peripheral nerves are routes for signals to travel between our central nervous system and the rest of the body. If I'm going to feel a mosquito on my arm, then a signal that something's moving has to get to my brain. And if I want to brush it away or pop it, then I have to get signals to my muscles to contract the way they should. Those signals travel through structures we call nerves. As a quick review, remember that anatomically the nervous system has two divisions, the central nervous system and the peripheral nervous system. The central nervous system is the brain and spinal cord, and the peripheral nervous system is everything else. Those are anatomical divisions. There are also functional divisions of the peripheral nervous system. Afferent neurons carry sensory signals from the periphery to the CNS, and efferent neurons carry motor signals away from the CNS to muscles and glands. Neurons are the cells that transmit those signals. Neurons receive input at their dendrites and send output along an axon. Neurons come in different shapes, and a lot have dendrites that connect directly to axons. Axons can be really long. So in the peripheral nervous system, a single axon can connect the peripheral tissue with the central nervous system. As an example, if I tickle this teeny little bit of skin on my arm, a single axon will carry that signal to the spinal cord. The axon travels through a structure called a nerve. As a definition, a nerve is a collection of axons traveling through the peripheral nervous system. Sensory nerves only carry axons of afferent neurons. Motor nerves carry axons only of efferent neurons. And mixed nerves carry both sensory and motor signals. Most nerves have thousands of axons, so they can be really big and you can see them during surgery or a dissection. Peripheral nerves have a common structure. If you watch the video on muscle, you're going to see common terminology. The entire nerve is surrounded by connective tissue called the epineurium. Within the nerve are fascicles, or groups of axons, that are surrounded by connective tissue called a perineurium. And then within the fascicle, individual axons are encapsulated in a delicate connective tissue called an endoneurium. The axons can be myelinated or not. If they're myelinated axons, then the Schwann cells or neurolymnocytes are encapsulated also within the endoneurium. Nerves are collections of axons that are carrying signals between the central nervous system and peripheral tissue. So those axons have to be connected to cell bodies somewhere. Some of those cell bodies are in the central nervous system, but there are also a collection of cell bodies in the peripheral nervous system. Collections of cell bodies in the peripheral nervous system are called ganglia. The ganglia are generally surrounded by the connective tissue that also surrounds the nerves. Quick summary of the anatomy of peripheral nerves. Nerves are collections of axons carrying signals between the central nervous system and peripheral tissue. Each nerve is surrounded by a tough connective tissue called the epineurium. Within the epineurium, bundles of axons called fascicles are separated by a connective tissue called the perineurium. Within each fascicle, individual axons are surrounded by a more delicate connective tissue called the endoneurium. Sensory nerves only carry the axons from afferent neurons. Motor nerves only carry the axons of efferent neurons. And mixed nerves carry both sensory and motor signals. Most of the nerves we talk about are going to be mixed nerves. Collections of cell bodies in the peripheral nervous system are called ganglia.